Coming to continuation of the previous year NEET question 2025, a question on nephrology. So we'll read from the last line. What explains the adverse effect? Okay, it's a small question. A patient on hydrochlorothiazide develops renal stones. So the question may seem a little complicated. So we'll just take some time to read about two important diuretics, loop diuretics. I chose this question for discussion because many onliners can come from this concept, not this question actually. Loop diuretics and thiazide diuretics. So if you think of the nephron, we have glomerulus, proximal convoluted tubule, and we have the loop of Henle, the descending limb, the loop, and the thick ascending limb of the loop of Henle. This is the thick ascending limb of loop of Henle. We have one important channel here, which is NKCC2 channel, that is sodium potassium 2-chloride channel. Okay. Loop diuretic inhibits this channel. Whereas in thiazide diuretic, we have the next step. Following the loop of Henle, we have the distal convoluted tubule, where we have NCC, that is sodium chloride cotransporter. Sodium chloride cotransporter. Thiazide diuretic inhibits that. So when the reabsorption of these ions in the thick ascending limb or the distal convoluted tubule happens, the renal tubule gets concentrated with these ions and it gets excreted. Okay. One important difference between loop diuretic and thiazide diuretic is there is something called as solvent drag, which means even though only these ions are inhibited technically, by the ionic difference and by the charge difference, there's something which occurs called as solvent drag. Many other ions also get excreted. So in loop diuretics, what all ions get excreted is sodium gets excreted through the kidneys, chloride gets excreted, potassium gets excreted, calcium gets excreted, magnesium gets excreted. Okay, so these major ions get excreted. In thiazide diuretic is similar to loop diuretic. The only difference is calcium does not get excreted. So sodium, chloride, potassium and magnesium all get excreted, but calcium is not getting excreted. So when you tell like this, we can use another technical term. Since calcium is getting excreted, we can call that term as hypercalciuria. In loop diuretic, hypercalciuria occurs, whereas in thiazide diuretic, there will be hypocalciuria. Okay. Since more amount of potassium, more amount of these ions are getting excreted, what all can occur? Hyponatremia can occur. Hypokalemia can occur. Hypochloremia can occur. Hypomagnesemia can occur. That is low amount of these ions in blood. Since calcium is also getting excreted, that is, since there is hypercalciuria, patient will have low calcium in blood, that is hypocalcemia. Okay. So in thiazide loop diuretics, there will be hypocalcemia. So what happens in thiazide diuretic? Nearly the same. Sodium gets excreted, so it causes hyponatremia. Potassium gets excreted, so it causes hypokalemia. Chloride gets excreted, so hypochloremia. Magnesium gets excreted, hypomagnesemia. But hypocalcemia will not occur Because there is hypocalciuria. That is the only main difference between loop diuretic and thiazide diuretic. In loop diuretic, calcium is also getting excreted, so it is called as a powerful diuretic. Thiazide diuretic will not cause that much of hypomagnesemia. Another small technical difference, try to remember it if you can. Loop diuretic causes more of water excretion than sodium excretion, so the hyponatremia is less pronounced in loop diuretics. Whereas thiazide diuretic causes more sodium excretion than water excretion, so hyponatremia is more pronounced in thiazide diuretic. So if you compare loop diuretic and thiazide diuretic, loop diuretic causes less hyponatremia compared to thiazide diuretic. You can try to remember if you can. Now if you extend these points clinically, because of this point, because loop diuretic causes more of hypercalciuria, loop diuretic can cause calcium stone formation. Whereas since in thiazide diuretic hypocalciuria is there, it actually protects against calcium stone formation. So thiazide diuretics are one group of drugs which are used in chronic calcium stone formation to protect against calcium stone formation. Actually, this question is that only. Patient is on hydrochlorothiazide, which is a thiazide diuretic. He might have been given hydrochlorothiazide to prevent stone formation, to prevent calcium stone formation. Remember, there are 4 types of stones, right? A side note: calcium oxalate stones, citrate stones, uric acid stones, and we have the triple stones or struvite stones. Okay. So everyone has different characteristics. To prevent calcium stone formation, we actually give thiazide diuretic. One example for loop diuretic is our famous furosemide or toracimide. One example for thiazide diuretic is chlorthalidone or hydrochlorothiazide. Okay, so I think this will be clear. Loop diuretic acts on NKCC2 channel in the thick ascending limb of loop of Henle. Thiazide diuretic acts on distal convoluted tubule sodium chloride co-transporter. Sodium, chloride, potassium, calcium and magnesium all are lost due to loop diuretic, whereas calcium is preserved in thiazide diuretic. So there will be hypercalciuria with loop diuretic. There will be hypocalciuria with the thiazide diuretic. So hypocalcemia occurs with loop diuretic, whereas all the other remaining hyponatremia, hypokalemia, hypochloremia, hypomagnesemia occurs with both, but hypocalcemia occurs only with loop diuretic. Hyponatremia is less pronounced with loop diuretic, it is more pronounced with thiazide diuretic. So calcium stone formation is more with loop diuretic. Calcium stone formation is protected on using thiazide diuretic. Example of loop diuretic is furosemide and toracimide. Example for thiazide diuretic is hydrochlorothiazide, etc. Another one important extended value is, if you remember the mnemonic BFGT, boyfriend got time. B stands for Bartter syndrome. So Bartter syndrome is one channelopathy of the kidney which causes electrolyte imbalance. Bartter syndrome is similar to furosemide. GT, Gitelman syndrome, is similar to thiazide. So just remember the mnemonic: boyfriend got time. So if any question, even though questions may not be asked on furosemide or thiazide, questions may be asked on this. So if someone asks you the question, which of the following syndromes causes hypocalcemia, Barter will be the better option because barter and furosemide are the same. If you remember, furosemide is a loop diuretic which causes hypocalcemia. Barter is an ionic channelopathy which causes the same. Gentleman syndrome, there will not be hypocalcemia. So, in the evaluation of these syndromes, there is something called calcium chloride ratio in urine. Since calcium is lost due to Bartter syndrome or furosemide, the calcium chloride ratio is increased in urine in Bartter syndrome, whereas it is decreased in Gentleman syndrome. Okay. Just remember, Bartter syndrome there will be hypocalcemia. Gentleman syndrome there will not be hypocalcemia. So to discuss this point only, I chose this question. So we'll read the options. So patient on hydrochlorothiazide, he develops renal stones. What could be the effect of this? He said due to increased urinary calcium. We just discussed now, thiazide does not cause increased calcium excretion. It causes hypocalciuria only. There is decreased urinary calcium excretion. So option A is wrong. So option B is actually the effect of thiazide diuretic. There is decreased urinary calcium, but is this the cause of adverse effect? No, because we just discussed hydrochlorothiazide is protective against renal stone formation, especially calcium oxalate stone formation because of decreased urinary calcium. So even though decreased urinary calcium is an effect of hydrochlorothiazide, don't be impulsive in writing this as the answer because it is not the answer for this question. It does not lead to stone formation. Decreased urinary citrate. I think this could be right because if you remember the pathogenesis of stone formation, citrate is a substance which prevents against stone formation. So decreased urinary citrate actually can lead to stone formation. But whether thiazide leads to decreased urinary citrate, we actually didn't discuss. Actually, this is one of the effects of thiazide. There will be decreased urinary citrate. Just remember it as an add-on. Increased urinary citrate is not the wrong answer. It's the wrong answer. Even if you don't remember other options, in this case you can easily exclude increased urinary calcium and decreased urinary calcium. And if you had read somewhere that urinary citrate is an anti-stone formation molecule, decreased urinary citrate can easily come as an answer to you. Right? That is the reason why you should discuss multiple points in multiple subjects. In somewhere it may help you to get associated.